Hello, I'm Robert McMullen, MD, and I want to talk about those people that have a little depression persisting despite being on some antidepressant and what the possibilities are. And as I've gone over this and thought about it, there's a lot of possibilities. I've been practicing psychopharmacology for over 35 years, and the last 9 years I've also added TMS, transcranial magnetic stimulation, another modality that also is very beneficial. And I shouldn't leave that one out as something to add on here. So say someone is on some antidepressant or more and they're still chronically depressed. What should they think about? Now, one thing is, there's a few things. As far as blood test, they should get a TSH, thyroid stimulating hormone. And there's a new bar for this, that the TSH should be below 2.5. And this is according to the American Thyroid Society, and a lot of doctors are still using a different level. But if the TSH is above 2.5, that means if you add some thyroid hormone, especially cytomel, it may help your depression. People should also get an MTHFR gene. About 1 out of 5 people have an abnormality here, and that indicates that if you take a certain folate vitamin, L-methylfolate, 15 milligrams a day, it'll help depression. And people should get a B12, since that vitamin is frequently low. And people should get a vitamin D, because everyone is low on that unless they're taking it. And you should watch a lecture by Michael Hollick on YouTube, and you'll never think the same about this again. But this is a steroid hormone that for millions of years we've made all of it we needed with the help of the sun. We make it in 5 steps, but one step requires ultraviolet light from the sun, and we need about a level of 30 for good bones, but for really optimal health, we need a level of about 70. And it reduces the risk of breast cancer and colon cancer, but it's a little bit involved with depression, not a giant amount, but a little. And weight, if you lose weight, it helps depression. The fat cells make chemicals that irritate the brain and cause depression. Now, I don't know if I mentioned HSCRP. This is highly sensitive C-reactive protein. If this is high, this really can contribute to depression. It's a measure of inflammation in the system, and it's often high when you're heavy. It's high when you have an infection. But if you lower it, and there's various ways of doing it, including taking fish oil and taking a cholesterol medicine, that can help depression. Now, lifestyle makes a huge difference. If you're not seeing friends, if you're not getting out there having a good time with friends, you're going to be depressed. Staying alone is deadly. 100 years ago, 200 years ago, nobody lived in a little house by themselves. Everybody lived in a house with all sorts of, or they lived in a hut with all sorts of relatives. The only person that lived in a hut by themselves was a witch. And she lived out in the middle of the woods in a nice little house. But that's why she was there, was because it was so unusual. But here we live in these apartments by ourselves. It's not what humans were evolved for. We're just not. It's just not a correct way of living for us. And a lot of exercise. You know, we've always had a lot of exercise, and now we don't. And that, doing a lot of that. You see people that turn their lives around and say, I'm going to run a marathon. And they're completely out of shape, they don't get any exercise, and then they start doing that. And it changes their whole life. And that is the kind of change that would also help depression. Now, other things that can help with the depression is adding a diabetes medicine called Victoza or liraglutide. It's an injectable diabetic medicine, and it helps executive functioning and it helps you lose weight. But the fact that it helps with concentration and it helps with mood is helpful. Modafinil, Provigil, that helps with executive functioning, and then that ends up helping the mood. And the stimulants in general, Adderall, Ritalin, Vyvanse, those help people focus better. They may have a direct effect on lifting the mood, but many people claim the fact that they help people concentrate better and function better and organize themselves better is part of the reason that they start feeling better so fast. And also, a lot more people have some attention deficit disorder than is believed. Anybody that's not responding to something should add low-dose lithium, 150 milligrams. Almost no one gets side effects from this. In the last 3.5 years, I've added it to, I don't know, maybe 200 or 300 people. And I've had 51 people that within 2 weeks, their mood lifted. And many of these people I've known for decades, and they were doing okay, but maybe they were drifting around 5 or 10% below normal, and within 2 weeks, they just felt better. And I have a couple of people who, or a few people, who it seems to have made a big difference looking back 2 years now. One woman who's 62 said she's been having depression sweep over her for half an hour or so, twice a week, all her life since her teens, even during the periods when she's been doing very well on antidepressants. And she realized recently she hasn't had a single episode in a year. And she's not sure what was happening in the months before the year, but for 1 year she's had not one, which is something she found really amazing. And we started lithium 150 milligrams 2 years ago. And she says she's also having a lower bottom. Maybe she'd drift down 10 or 15% sometimes with circumstances, and now she just drifts down 5%. And it really seems clear to her that this has made a difference. So it certainly wouldn't hurt. And lithium also prevents Alzheimer's. So anybody getting close to 60, I really push them to take 150 milligrams once a day, or even less if they won't do it. Now, if somebody's on a serotonin medicine like Prozac or Zoloft or Celexa or Lexapro, sometimes these leave you a little flat and you're just not quite as animated or concentrated as you could be. And the SNRIs may be a little better, like the serotonin norepinephrine reuptake inhibitors like Cymbalta, duloxetine, Fetzima, Pristiq, and there's another new antidepressant called Trintellix, and that one helps out concentration. It's even helped out concentration in people that are not depressed. Another thing that helps when someone is on a serotonin medication and they're not up to 100% is to add Wellbutrin. The combination of Zoloft, sertraline, and Wellbutrin, bupropion, was used so much in the past that people called it Welloft, combining Wellbutrin and Zoloft, the names. But they make a great combination because then you're going at the depression from a couple of different angles, and so it's more effective as an antidepressant, and you're on a lower total dose. Now, if your symptoms, there's two different types of depression, sort of. There's the classic depression where people can't sleep, they're waking up during the night, they sometimes wake up at 3 or 4 a.m. and can't get back to sleep, their appetite goes down, whether events happen in their life or not doesn't really make their mood change that much. And then there's what's called atypical depression, which makes up about 1/3 of all depressions. And in the atypical depressions, people tend to sleep too much. They could sleep 12, 14 hours if they were allowed to. Or maybe they only at certain periods in their life during their depressions would they be able to sleep a lot. And their appetite tends to go up, or at least their craving for carbohydrates goes up. And they're more reactive to events. Some really good event might really lift them out of their mood. Recently I had someone who had some friends come from out of town, and they weren't even her friends. They were her husband's friends, but he was too depressed to go spend time with them, so she spent time with him for 2 days, and her depression completely lifted. She had a great time and just really enjoyed herself and was completely out of depression for the first time in quite a while. That's an atypical depression. And people with atypical depressions also go into depressions with bad events. A bad event will easily put them into one. And they tend to be rejection sensitive. So if you make a mistake, a little mistake, and then somebody you respect is upset about it. And so they're a little angry. Not that much, but they're a little angry with you about it, and they give you a little hard time, and it ruins your whole evening. Then that person tends to be rejection sensitive. Or if there's a romantic breakup and they just take it really badly and go to bed for 2 weeks, or just stay very depressed for months or a year, that's a sign of being rejection sensitive. And sometimes the breakup was with somebody they really didn't think was appropriate in the first place. Now, if someone has those atypical signs of depression, then the serotonin medicines may not be the best thing in the first place. They should definitely try switching to a low dose of lithium, like 150, and slowly switch to Lamictal, Lamictal, generic name is lamotrigine. It's a anti-seizure medicine that came out in 1994, and the neurologist immediately saw people come out of depression on it. It's very low in side effects. The dose for depression is very low. It's 200 milligrams, whereas for seizures you use 400 to 800 milligrams. And it's safe in pregnancy. So we take women through pregnancy all the time on it. And the neurologist, whatever they're on, they take them off of it and switch them to Lamictal for a pregnancy. The combination is very good in atypical depressions. Another thing in atypical depression, especially if it's a really severe depression, you may not have time to wait around on low-dose lithium and Lamictal. Lamictal, you got to go up slowly over 5 weeks to avoid a rash. You might want to use an MAO inhibitor. Those are the antidepressants that you can't eat cheese on, or your blood pressure will go way up for a few hours. And they work better than anything else, especially in this type of depression. And they can also be used long-term. And another thing would be to use TMS, transcranial magnetic stimulation, and that works for any type of depression, typical or atypical. And then after that, there's always the question of what you should be on as maintenance, because you should stay on some maintenance medication to prevent the depression from coming back. And usually, I like people to be on 150 milligrams of lithium and some Lamictal, 200, because of the negligible side effects and the high efficacy. There's high efficacy and high tolerability, and that's what's important. This is more complicated than I thought when I go through it all. And it's a lot of things all at once. And every one of them is important if it happens to involve you. You know, if your thyroid value is off, or if you've got this MTHFR gene, or if your inflammation level, your HSCRP, or you could call it CRP, is high, these are important factors that could be significantly affecting your depression. And the vitamin D, I suggest everybody go read up on it and listen to Michael Hollick's lecture, because even doctors discount it. One of my good friends and one of the most important people to me professionally just died a couple of months ago, and I really think it was because of low vitamin D. That he knew all about vitamin D. We'd exchanged letters. He'd read all the papers. He's a psychopharmacologist. He had a PhD and an MD. He understood it. He took the right dose. And then he got colon cancer and called me about it. And he was going in for surgery. And I told him that there's evidence if you're on enough vitamin D, at the time of the colon cancer, you're 1/3 less likely to have the metastases come. You're 1/3 less likely to have the cancer spread. And he was pleased to hear this. And he asked for the dose. I gave him a dose. I sent him a paper. But that means he hasn't been taking it. So he was taking it years ago, and he must have just slipped his mind and he stopped taking it. And then, during the surgery, something went wrong, and he ended up getting septic. And he died during the surgery. Now, the vitamin D is important for your immune system, and I looked up a few papers, and the surgeons have papers on this, that people with low vitamin D don't do as well in surgery because their immune system is down. And it's very likely that his low D allowed him to have the colon cancer, and that his low D also allowed his immune system to not function as well as it should have, and then the combination, he didn't survive this cancer. It's a very important thing, which is for some reason not widely known. And anyway, this is Robert D. McMullen, MD, and I've just had a few things to say about chronic depression that's not getting completely better, and some various ways to bring it to 100%.
Thank you very much.